Okay, we have a dog here showing lovely, normal behaviour. So we're nice and calm and comfortable. It's nice and quiet in here. Any possible abnormal behaviour that I would be looking for would be things like excuse me, aggression, so possibly lunging at the door, growling or showing teeth. This could also be displayed in nervous behaviour, so we might see whale eye or avoidance, excessive salivation or licking of lips. So I'm pretty confident with handling this little darling. If we were to see these sorts of unwanted behaviours, this would be something we'd need a team member to assist with. We would use PPE such as a muzzle, slip lead, and just ensure that we have enough staff to handle the patient. So unfortunately in the clinic there are lots of possible triggers for stress. These can be other dogs, barking excessively. It's a very noisy place. There's lots of unknown smells and noises and people. So it's really important that we try and limit these stresses where possible. So this is a lovely quiet little kennel room with a soundproof door. So this is a great way to sort of limit the sound in here. And you can see both dogs have responded well to this. They're both nice and comfortable. It's important if we have dog-aggressive dogs that we label the kennels accordingly so we don't have them come in contact with other animals. And if we have dogs that are difficult to handle, again, we label that so all staff are aware of the potential risks. There are a number of food enrichment toys that we can use with a dog. So I've got a couple of examples here. The first one is very popular. It's a Kong toy. It's weighted at the bottom and the dogs can work at it to get treats out. The second one is more of a puzzle-based toy. The dog needs to move the little buttons to get the treats inside. And the third is my favourite. This is called a snuffle mat. This one is homemade. You can hide the treats in here, and the dogs need to work and sort of dig around to get at the treats, which is a great instinctive behaviour for them to carry out. With cleaning, with the hard surfaces, we would soak in Clinikill, and the soft surfaces like the snuffle mat, we would just wash in the laundry. Obviously, if it had come into contact with an infected patient, we would use an F10. If they're damaged in any way, we throw them away. All of these products must be used with supervision because, of course, we have some more destructive dogs that might want to chew at the plastic and ingest that. So there is a risk to the patient there. They're a good way to feed dinner as well. So instead of just feeding in a normal bowl, feed them, make them work for their dinner so that they get a bit more enrichment than just eating out of a normal bowl. If the toy is too difficult, we would see boredom, frustration and disinterest in the toy. And if it's too easy, then we'd also see boredom and disinterest. So it's important to choose an appropriate interactive toy for the dog. Also, the treats that we dispense out of them, or the food, must be dietary appropriate. So, for example, if we had a sensitive stomached dog, we'd only put in something that they're on, so maybe gastrointestinal food. I wouldn't be putting in high calorie, high fat liver treats that could possibly upset the gut. Free! Good girl. Okay.